We went on vacation and started having pain on the plane. Rested a little bit once we got to the condo, but I told my husband, in the middle of the night, we have to go to the ER. So they did a CT scan, kind of unexpected to get that diagnosis, leiomyosarcoma. In July of 2019, I had that primary tumor removed. Clear margins, so we didn't do additional treatment at that time, but I had 3 small spots in my lungs that were kind of let's watch these and see what happens. A few months later, came back for scans and had a few more spots in my lungs, so at that time, I started chemo.
My name is Suparna Clasen. I am a cardio-oncologist. I've had the privilege of taking care of Ms. Adams for 4 or 5 years now, and I've been with her for her long oncology journey. She has an uncommon tumor type that has necessitated chemotherapy by the traditional sense, surgical resections, and immunotherapy, and then sometimes clinical trial directed therapies. Kari also has cardiovascular risk factors, namely she's got a family history of heart disease, and she has some uncontrolled blood pressure and insulin resistance and insulin-dependent diabetes when I met her. Our oncologists are phenomenal. They manage everything about their patients' health. What we offer here in cardio-oncology is a partnership to manage cardiovascular health in our oncology patients.
The second chemo drug that I was on, I started at the end of 2019, late December. It can add some additional cardiac risk factors. That's the one I think she talked about that can cause damage to the heart muscle itself. And so started having regular echoes at that time just to watch the heart muscle and make sure it's functioning the way it is and I didn't have any loss of function there. It really does feel like a village, and I don't know that I could ever fall through the cracks, and I can't get away with anything because what one of them doesn't figure out, the other one does, and they'll call me out on it. So, I feel like I'm a player on this team as well. I've got to do what I need to do to take care of myself, but they're there to help guide me through that process.
Patients like Kari continuously remind me why I get up in the morning and do the job, right? Because it's oftentimes a really scary, tough time in patients' lives, and we have a privilege to be there and be part of their journey.